I'm Tom Whisenhunt, specialty is neurosurgery. That's East Alabama, neurosurgery and spine. I knew I wanted to be a doctor when I was in first grade, and my dad and I were leaving a soccer game, and he had his finger nearly cut off in between two doors, so he drove himself with me to the emergency room in Alex City. The ER doc asked if he could tell I was interested and asked if I wanted to watch, so he put me on the bed next to him and walked me through step by step how he was sewing his finger back up. And I was in first grade, and I knew right then I wanted to sew people. It wasn't so much that I wanted to help people like normal practitioners, but I knew I wanted to do surgery at that point. And so there was just a long course through Minnesota and California. I did a lot of research in California in neurodevelopment, which got me into the neuro side of things. And then at UAB, working on my PhD, worked with a neurosurgeon there, and just saw that there was a lot of unknown still in neurosurgery, so it just kind of pushed me towards that direction. So neurosurgery is focused on treating surgical disorders of spine and brain, peripheral nerve, whether it's tumors or trauma, deformity, anything that has to do with the nervous system or the spine. So most of our patients are patients that have come through a referral basis from either orthopedic clinics or from their family doctors, primary care, urgent cares, who have gone to them for back pain or neck pain or headaches or something along the line that's led to an MRI that has found something concerning to be a potential surgical treatment. Most of them have already had treatment, conservative as far as physical therapy, anti-inflammatories, injections, pain control, that sort of thing. And when none of that's working and surgery is another option, that's usually when they come here. There's no one here doing minimally invasive spine. There is no neurosurgeon here doing anything for the brain or more complex nerve and spinal cord pathology. And so I always wanted to go somewhere where there was a need, and this is a growing community with a growing medical population, so it's a good step for the area. For minimally invasive spine, I was doing them in Montgomery before. Otherwise, you had to go to Birmingham. There's not a lot of places still doing minimally invasive. I do cortical screws, which is a smaller, more minimally invasive fusion, and no one really in Alabama is doing that at all. Most people from this area would end up in Birmingham, or some to Columbus, some to Emory, some to Montgomery. It's the travel and having to stay, and because some of these things do require 1 to 3 days in the hospital, and so that can be rough on family. Follow-up can be rough, so not having to travel as far to get most things done is going to be easier on everyone. So in our week we have 2 days of surgery and 2 days of clinic. Our clinic usually runs from about 8 to 4. That's Tuesday, Thursday. Monday, Wednesday are scheduled surgery days. One usually at the surgery center, one at the hospital for the bigger, more complicated cases. And then, of course, any kind of thing that comes through call, we'll have to deal with at the hospital as needed. I enjoy spine surgery the most. It's just more of the kind of orthopedic, nuts and bolts kind of surgery that I enjoy. Probably the most challenging is just making sure that you're doing the right thing for the right patient, because you don't want to do a surgery that doesn't work. You don't want to put somebody through any kind of anesthesia or an invasive procedure and not have benefit that they're hoping for. So far, we've really enjoyed our time here. The food scene is awesome. Just like the outdoor kind of feel here. We do a lot of mountain biking, so we've been to the state park, and so it's exciting to be able to do some of that. Recreationally, I'm an avid car and motorcycle person, so I work on my own cars, I rebuild my own cars. I have 2 lifts in my garage, so I can do everything from, I just did a transmission on a truck I bought. So that's just kind of fun, working on cars and motorcycles. I used to race motorcycles for a living, so I still spend a lot of time on motorcycles. I've broken my back twice, I've herniated 2 discs, so I understand what it's like to be a spine patient. I've been there. It's great when patients have tried everything and they've had a problem, they've worked through everything possible to avoid surgery, and then we go in and remove a disc or take pressure off a nerve and realign, and then they've got significant pain relief. They're able to get back to walking normally and doing their normal activities, and that's always our goal.